Hello everyone. Now we are going to see about what we know that in pregnancy, in obstetrics, we have divided whatever the concept into three parts. That is antenatal, antenatal, then antenatal, intranatal, and the postnatal. In antenatal, what we have seen. Okay. In antenatal, what we know that we have seen from the mother and the fetus, or in mother, what are the normal things what we have seen in the previous session. That is what we have upload in the YouTube channel. But whatever now next part, what we are going to see about the whatever the abnormalities which takes place in the means abnormal in the mother which takes place during the pregnancy. We know that mother is having problem, general problem or local problem. In general, what is meaning of general problem? That is what we know that whatever the complaints which are related to the person as a whole, that is comes under the general. And what is the local problem? That is the problem related with the particular that is uterus. There may be some problems with the that is bleeding is there or sometimes there is a problem. That is local problem related to the uterus. So now what we are going to see about the general problems of the pregnancy that mother related with that of mother. Just as we are talking with both senior batch and the senior batch and the junior batch. Now, I'm just giving initially concept of it. That is what is the ops as such. This is the revision for the senior batch also. We know that the whatever the entire life of the female, starting from her birth, starting from her birth to that of till her entire life, it is divided into that is the puberty. Then she goes into the reproductive life. Then her menses get stopped. That is the menopause, and up to the death. That is the geriatric concept. Okay. Please, there is one rule for the lectures, that is the senior or junior batch. Whatever is you have to, if you have any complaints, please last 10 minutes we will going to keep it for the query section. But during the lectures, I don't want any something pain and whatever the using it. So I need your cooperation because it is very difficult for me to just manage all this whatever writings which is coming on the board. So senior batch students, they are managed with it very nicely. They are cooperated with it very nicely. So same cooperation I am expecting from the junior batch also. If you have any query, you can ask it 10 times. I don't mind about it. But during lecture, I don't want any misbehavior. So that basic cooperation I expect from you people. So fine. If you don't understand, let me know. Fine. Okay. So, I will start with that. What is meaning of OBS? So, obstetrics, that is, if you see the entire lifespan of any female, that is from her birth, then whatever at the age of 16, she goes into the, what is it, puberty, and from puberty, at the age of 35, she goes into the menopause, that is where the menses at the stop, that is called as a menopause. Okay? And menses get stopped. And what is reproductive life? That is from the 16 years to up to the 45 years. Her menses get, that is the whole period. It is called as a reproductive life. Fine. And that in that reproductive life, then the ovum and the sperm get united into the fallopian tube, that is called as a pregnancy. So whatever, finally, what is the difference between gynecology and the obstetrics? In gynecology, we are dealing with a single entity, that is single female, starting from her birth to her entire life. Whatever the normal and the abnormal which takes place, it comes under the gynecology. While what is in obstetrics? In obs, we are dealing with both male, mother and the fetus. That is two one. We are dealing with two. And what is the total period of obstetrics? It is total period of obstetrics. It is the pregnancy. That is 9 months, 7 days, and the time after the delivery. That is 6 weeks. So how much for obstetrics time it is? From the fertilization till the delivery and the time after the delivery. Hello, are you understanding it, what I'm talking about?
Ma'am, your voice is not clear.
Okay, fine, I will make it clear. I'm audible now? Hello, hello.
Ma'am, your voice is not clear.
Okay, fine. Now,
Clear. It is not audible.
now, hello. Whether I'm
Hello, ma'am.
audible, whether I'm audible properly.
Ma'am, your voice is not clear.
Okay, yeah.
मैम
हेलो,
थोड़ा
हाँ,
एको हो रहा है एको हो रहा है
इको अभी आ रहा है अभी?
आवाज आ रहा है।
अभी आ रहा है क्या?
हाँ ठीक
हाँ
Yes,
अभी आ
ma'am.
रहा है।
हाँ मैम
Okay, sure. Now, again, fine. Thank you for this cooperation from your side and the suggestions. Most welcome. Fine. Okay. Now we are talking about the obstetric part of it. What is obs? Because in first term we learn about the gynecology, and in second term we learn about the obstetrics. So for the senior batch, it is the obs that is what we have started with. For the junior that is also with us, I'm just giving some little bit of information regarding what is OBS. So what is OBS as such? Obstetrics is the part that is when the ovum and the sperm unite together and fertilization takes place from here up to the delivery. That is in human being, the delivery, the total pregnancy time, it is 9 months, 7 days, and the time after the delivery, that is 6 weeks, whatever that is takes place, normal and abnormal, to both mother and the fetus, is called as obstetrics. Clear it? What is OBS as such? Hello? So in that, what we are going to see today, that is whatever the problems, obstetric, again for understanding purpose, it is divided into three parts. That is the antenatal, intranatal, and the postnatal. What is meaning of anti? Anti something before, natal means delivery. So something before the delivery, it is called as antenatal. If the time, whatever the problems which takes place, normal and abnormal, that is comes in the intranatal. And the time after the delivery, it is called as the postnatal. Same thing. Again, it is divided into both, that is mother and the fetus. Now, in previously for senior batch, I have covered the normal part of the pregnancy. That is what is basic, what is meaning of fertilization, of placenta, the umbilical cord, what is the amniotic fluid, what is its function. That is everything related with the mother, normal things we have covered it. Now, what we are going to see about the abnormal part. So abnormal. Related to whom? Okay. What are the problems which can take place to the mother? That is, she may suffer from that. Of what is the common things? What we see in the movies? What will happen? That is when any female is pregnant, what we see in the movie that she starts the vomiting, and that is the seen as the early signs she is pregnant. The same thing, this problems which can
हॅलो
huh?
मॅम
बोला
मॅम म्यूट करायला सांगा ना
please please students, junior batch students, please mute your this one. Please, if you have query, you can open it, but still, please mute because I'm having disturbance in the process. Okay, fine, thank you. Okay, now what we are going to see, that is what you see in the commonly in the movies. That is the one lady is there, and after marriage she started the vomiting, and they are considered, oh yes, she is pregnant. So sometimes it may, that is normal nausea and vomiting which can take place during the pregnancy. But there is a situation that is where there is a excess of vomiting during the pregnancy, then it may be having a deleterious effect on the mother's health. So that what we are going to say. What we are saying here, it is NVP. What is NVP? Nausea and vomiting during the pregnancy. So that is common thing that is going to be there. That is what is the symptom? That is nausea and or. So it is not every time she is going to have the vomiting. Sometimes she may have the vomiting. Sometimes she don't have the vomiting. When it takes place, yes, definitely in the early pregnancy. Now question, what is meaning of early pregnancy? Early pregnancy, that is in the first trimester. That is at first 3 months. That is called as a early pregnancy, where there are no any other causes. There is no any other causes. Still, there is a vomiting. Then it is called as a nausea vomiting of pregnancy. Now, second thing, what is hyperemesis gravidarum? From the word, see the proper word. What is hyper? Simple word. Hyper means something more than that. Emesis means emetic. That is vomiting. And gravidarum. What is meaning of gravidarum? That is related with that of pregnancy. So when the nausea and vomiting is so much that which takes place during the pregnancy, so that is called as a hyperemesis gravidarum. What is it? It is very severe, protracted form of nausea, vomiting of pregnancy. That is, there is a triad. What are the combination of it? There may be more than 5% weight loss. What is important? Why we see that? Because during the pregnancy, there is a weight gain. How much weight gain is there? It is about some 10 to 11 kg weight gain. And what happens in that situation? See the scenario. Two females are there. One female is there that is come from your clinic. Both are having some 4 months amenorrhea. And one is having 3 months amenorrhea and one is having 4 months amenorrhea. So both females patient comes to your clinic. And one patient is having nausea and vomiting, but you ask him, what if there is any problem in your weight? No, no, she does not say that. I don't have any problem. Her weight is increased. That is, for example, if a patient comes to you in your clinic, female patient having 2 months amenorrhea, and complaints. If you ask the complaint, what she says that I am having nausea and vomiting. Then what is next question you ask is, okay, what is the weight you are having previously? She says that I'm having weight some 55. Now after 2 months I'm having some 57. Then it's good. That is the weight is increasing and she does not have any problem. Okay, what is the complaint? She says that I'm having the nausea just early in the morning when I do just cooking and that smell gives me some problem. But it is affecting your day-to-day life. She said that no, I can do my job very well. I can do my life very well. So that is simple nausea and vomiting of the pregnancy. But what is second stage? Be patient. Comes to your clinic and how just see the scenario. What is the patient is having continuously, that is, as we know that if vomiting takes place, physiology will be that. The water loss is there. So she is having that collapse, some weakness, she is not able to talk properly, and there is a continuous nausea and vomiting. And along with that, if you see that in previously the weight was 57, and the previously the sorry, and now the weight is about 12. So now weight it is about some 56. So that is wrong thing because the weight should go weight increasing from 57 to 58, 59 because we know that physiology, the total weight gain during the pregnancy it is 11 kg. So she should grow from 57 to 58 depending upon the how much trimester she is having it. But what is the thing over here? In the patient her weight is decreased from 57 to 56. She's not able to do her day-to-day life. Then what you think of it? Oh, this is something problematic. So this is severe protective form of nausea vomiting. Only that much, then dehydration and the electrolyte imbalance. Now you know the physiology very, very nicely. What is the sign of the dehydration? When your hydration is proper, having your skin is proper, the tone of the skin is proper, you are growing very, very nicely. Then whatever dehydration, your skin becomes, you are able to pinch it. That is the sign of dehydration. Or what will if there is some sunken eyes and sometimes there is an electrolyte imbalance. So these are the symptoms. If these symptoms are combined, then what we think of this is related to this type of hyperemesis gravidae. Clear it? What is meaning of what is the basic difference between MVP and HG? Do you have any query? If anyone from our group, if you don't understand what is the basic difference between motion and hyperemesis gravidae, let me know so that if you don't have, so I can continue it further. Please raise. Hello? Can I continue? Just one of you?
Yes, ma'am.
Yes?
Yes, ma'am.
You got the basic difference
Yes,
between, are you
yes, ma'am. Yes,
understanding
ma'am.
where we are going? Abnormal part of mother, nausea and vomiting. Fine, I can continue further. Okay, now, if this triad, that is weight loss, dehydration, and electrolyte imbalance, that is related to that of hyperemesis. Now, how much percentage wise? Why we are saying this complaint? Why we are being important students? So whatever the 100 patients which comes in your clinic, 80% of these cases are normal, nausea vomiting. So what is the meaning of this? If you are having 100 OPD of ANC, all ANC patients, that imagine you are doing only the OPS OPD, gynec and OPS OPD, and out of 100 pregnant ladies, 80% women are having normal nausea and vomiting during the pregnancy. That's why what you see in the normal movies. What is normal scenario in the movies? If they want to show that the female is pregnant, they show that she's having some vomiting sort of. So what is most common indications for the hospitalization? Because if it is not tackled properly, so it is the most common indication for the hospitalization. And what is the time duration? When it occurs most commonly between 4 to 14 weeks of pregnancy. That is which trimester? What? That is which trimester?
First.
Very good. First, up to first, only first.
First and second.
Very good. Reason behind it, because first trimester is up to
12 weeks.
Very good. So that's why as it is from 4 to 12 weeks, so it is for in first trimester and in second trimester also. Now, second, usually it is mild and self-limited. So, whatever you don't have to take that much of care or medication is not required. So, if automatically, if any patient comes to you and says that I'm having some 2 months amenorrhea or 3 months amenorrhea and says that I'm having just little bit of nausea and vomiting, but it subsides afterwards. So, whether you are going to give the medication over here, whether you are going to give the medication, no need of any medication because it is self-limited. It can manage it on its own. Now, but 5% are nauseated until delivery. But out of this 100 पेशेंट अगर आपके पास फॉर एग्जांपल आप फर्स्ट देते हैं, आपके पास प्रेग्नेंट लेडी ओपीडी में आप कुछ तो कैम्प कर रहे हो या कुछ कर रहे हो, तो उसमें से आपने 100 फीमेल्स प्रेग्नेंट लेडीज आपने फर्स्ट डे पे लिया, तो उसमें से अप टू 3 मंथ्स तक आप सर्वे करते हो तो 3 मंथ्स तक मोस्टली नॉसिया वोमिटिंग सबसाइड हो जाता है। पर उसमें 100 में से 5 फीमेल्स ऐसी है, 5 females are like that. They are having nausea and vomiting continuous up to the delivery. So, out of 100, 5 females are going to suffer from the nausea and vomiting up to the delivery. So, that condition is called as, agar wo continuously, if it is present up to the delivery, then what is it called? Called as it is simple nausea and vomiting. Is it simple nausea and vomiting? Hello? Hello? Am I audible? आवाज
Yes,
आ रही है
ma'am.
नहीं? हाँ, तो अगर जो फीमेल्स है जिनको कंटिन्यूसली नॉसिया एंड वोमिटिंग हो रहा है अप टू द डिलीवरी, तो उसको क्या बोलेंगे हम लोग? अभी मैंने 5 मिनट पहले बताया था, उसको सिंपल नॉसिया वोमिटिंग बोलोगे अगर वो डिलीवरी तक हो रहा है। प्लीज बीच में जो आ रहा है प्लीज वो जो ड्राइंग्स निकालो, वी आर हैविंग सेपरेट ड्राइंग कॉम्पिटिशन फॉर यू पीपल। हेलो,
No.
व्हाट इज इट कॉल्ड एज? iPhone, okay, you can ask it the question. iPhone, someone is here. What is it called as? अगर वो 5 डिलीवरी तक उसको नॉसिया एंड वोमिटिंग हो जाता है तो व्हाट इज इट्स डायग्नोसिस?
Hypermesis.
Very good. It is a hyperemesis gravidarum. Okay, fine. Then, okay, may continue throughout the day. For कुछ पेशेंट को ऐसा नहीं रहता है कि चलो she is having just cooking and that may give the nausea and vomiting. Sometimes it may happen that she is having continuous vomiting throughout the day and it not disturb the patient's health or her baby. That is the scenario. Okay, so nausea and vomiting, it is common in primary gravida. What is primary? What is primary gravida? What is
Primary.
What is meaning of it? Please, it is very difficult for me to teach from some long distance. I try my level best, but I should understand whether you got it, the concept. That's it means that your concept should be get clear. What is primary gravida? Hello? What is primary gravida? Gravida, but obvious that is related with that of pregnancy. So what is meaning of primary?
First conception.
Good, good, good. First conception is called as primary gravida. Then young woman, that is related, young it says that, but obvious young woman is that in primary gravida. Sometimes obesity that is seen in obesity females, nausea and vomiting is common. And sometimes some have a history of motion sickness. What is motion sickness? What is motion sickness?
सफर के वक्त उल्टी होती है।
वेरी गुड, दैट इज जो ट्रैवलिंग करते हो आप, जब यहाँ से तुम बम्बई जाते हो तो घाट में बीच में जो मोशन हो जाता है ना, that leads to the vomiting. That is called as a motion sickness. So that is history of motion sickness and nausea and vomiting with oral contraceptives. अगर oral contraceptives what is it is a contraceptive oral tablets आप females लेती है और उस टाइम पे भी nausea vomiting होता है तो उनमें ज़्यादा common tendency है to develop the nausea vomiting and sometimes some psychiatric issues are there. Some females are having psychiatric अगर कुछ गंदा दिखता है तो उनको vomiting हो जाता है. So that is also related with the psychiatric issues. Junior batch and senior batch minded, whatever we are talking, you have to give the notes. So listen it properly. Okay. Now, what is the pathophysiology theory? We should know why it is happening, why there is a reason that pregnancy has taken place and it gives nausea vomiting. That is what we see in the scenario. That is before the pregnancy, female used to have the cook, she used to have the smell, but she previously does not suffer from any complaints. Now, what happened? Pregnancy, she get the pregnant, and afterwards she started this nausea and vomiting. So your sensible mind says that what is the reason that it has led to the that it has led that it leads to that of this complaint. So the reason is not fully understood why this is happening, but there are some factors which can say that yes, there is a nausea vomiting. So what is it is a phytoprotective or sometimes genetic factors. So what is genetic factors? Her mother is also suffering from the same complaint. Her grandmother is also suffering from the same complaint. So that may be the same, or some immunological, some biochemical, or some biosocial factors can be responsible. Or hmm, sometimes it is correlated with of increasing HCG. Now, senior batch, what is HCG? What is HCG? Hello? What is HCG? If you don't understand,
Human chorionic gonadotropin.
good. From where it is released? From where it is released?
Placenta.
Placenta. Chorion. It is released from the chorion. Just I am having 10 minutes left, so I will try to cover it. So it is a correlation with sometimes thyroid, progesterone, estrogen, adrenal hormones. These are also correlated. So that can lead to the problem with this. Or correlation with GIT, smooth muscle relaxation. Sometimes it may happen that during the pregnancy, whatever the hormones which are present can lead to that. Whatever the GIT smooth muscles get relaxed, also can lead to the nausea and vomiting. So these are some theories. So what is the pathophysiology theories? Sometimes psychological factors, sometimes thyroid gland activation in early pregnancy. Thyroid gland activation. So what we see that whatever she takes, it gets activated over here and gets nausea, vomiting. तो हाई फैट डाइट आप बहुत सारा फैटी डाइट खा जाते हैं ये जैसे कि आपने व्हाट इज विच फूड कंटेंट्स हाई फैट पिज्जा that sort of you take with pizza and all the sort of foods that can lead to the high fat diet. फिंगर चिप्स लेते हो या ऐसा कुछ फूड लेते हो जिसमें बहुत सारा फैट रहता है that food can lead to the vomiting and sometimes vitamin B6 deficiency and some helicobacter pylori that is this factor which what you see in this diagram can lead to this point this type of the problems that is pathophysiology that we see in the national vomiting. Then next, that is okay. Okay, causes. So what is the cause during the early pregnancy? It is the obstetric cause. Obstetric cause, that is molar pregnancy. Molar pregnancy, second synonym, it is vesicular mole. Or what is another name? Can anyone remember? If you don't know, I will let you know. What is molar pregnancy or vesicular mole? Third name?
Ectopic.
No, that is not ectopic.
Uh,
What is molar pregnancy? What is vesicular mole? Third name? Anyone knows it?
Hydatidiform mole.
Very good, that is right. It is the hydatidiform mole. Nice one. It is a molar pregnancy and the vesicular mole and sometimes multiple pregnancy. What is multiple pregnancy? Second synonym, maybe it's one of multiple pregnancy. And what is second synonym for hydromenose? What is second synonym for hydromenose? Multiple pregnancy, common thing. And hydromenose, the next word, it is polyhydromenose because you should know it. Fine. So that is obstetric cause. And during early pregnancy, non-obstetric cause, that is gastrointestinal causes. That is sometimes appendicitis, that is what we see in the surgery. Cholecystitis, what do you think that if any female patient comes to you in your clinic with pregnancy, it does not mean that she has only the obstetric cause. Sometimes it may happen that there is a combo of appendicitis and pregnancy. There is a combo of cholecystitis and pregnancy. There is a combo of pancreatitis and pregnancy. There is a combo of hepatitis and pregnancy, peptic ulcer and pregnancy, or some gastrointestinal or intestinal obstruction, or sometimes chronic infection of Helicobacter pylori. So don't think that every pregnant lady and comes in the nausea and vomiting should have only the obstetric cause. Sometimes we may think that we may neglect the non-obstetric cause. Non-obstetric cause that is related with that of gastrointestinal cause can lead to such type of the problems. So do you have learned appendicitis in surgery? Hello? Senior batch, do you have covered the topic appendicitis? Hello?
Yes, ma'am.
Yes. So can you differentiate between what are the other symptoms of appendicitis clinically? How can you differentiate between appendicitis and the obstetric cause? Do you know the obturator sign? Definitely, when you are going to do the clinically differentiate between, you have to do the obturator sign for the appendicitis. So for you now, this is the this one homework for you people, that you have to write the notes up till now, whatever thought we have taught it, and how you are going to differentiate between the appendicitis with pregnancy and only the pregnancy, cholecystitis with pregnancy and only pregnancy, hepatitis. How from the symptoms you are going to differentiate and how you are going to differentiate from the sign point of view. So this is the one, you have to write it proper notes of 15 point till what you have taught to you. And second point, you have to differentiate how you are going to clinically differentiate this point. Okay, so that is it. Do you have any queries till this lecture? If you have, please let it know. And it is what is the, it is some suggestions to all the students, because I don't know the proper name of your, someone is having iPhone, someone is having which phone. I know that you people having iPhone, but please give your name so that I can mention your attendance. Some of you just have your screenshots of your attendance, give it to me so that I can make your attendance, both senior batch and junior batch. Write your names. I don't know how, what is CP and something names are written it. I don't know the name. So there I write your proper name so that I can make the attendance. Anyone is having query? Hello?
No, ma'am.
Okay, you understand still what we have taught?
Yes, ma'am.
Okay, so take the screenshots of your attendance and some of you please send it on the group so that I can make it. Senior one is going to take the responsibility and junior batch is going to take the responsibility. Junior batch.
Amisha.
Okay, junior batch, please one of you take the responsibility and take the screenshot of your attendance of name of the student and please write your names on it and give it post it on the group. Okay. Hello.
Okay, ma'am.
Okay. Do you have junior batch? Are you understanding it?
Yes, ma'am. Yes,
Yes,
ma'am.
ma'am.
Please, I don't know the proper personal name of you, but I can understand. If you have any query, let me know so that I can explain it again. If you're understanding this the fashion that what we are teaching over here, or if you have any suggestion, please let me know. It's most welcome. And if you don't understand this fashion, I will try my level best in different. Fine?
मॅम आवाज नव्हता बरोबर येत.
Okay, I
आवाज
will.
क्लिअर नव्हता येत.
आवाज ना ठीक है माझा माइक का थोड़ा सा प्रॉब्लम है सर आई थिंक आई विल ट्राई अगेन मैंने रिपेयर में डाला था उसको फिर से मैं क्लियर करती हूँ कि नजदीक कुछ प्रॉब्लम है तो मैं देखती हूँ राइट
मैम रूम क्लोज रूम में मत बैठो, इको होगा।
क्लोज रूम में हो रहा है थोड़ा सा ठीक
तेरा
है
इको हो रहा है.
इको हो
कौन
रहा है
बोल
तो
रहा है
ठीक है
अभी?
इको
इको हो रहा है फाइन
तेज बोल
सेकंड
रहा है।
थर्ड सजेशन थर्ड ना कल ना नेक्स्ट कहीं पे दूसरे रूम में चेक करती हूँ कहीं पे वाईफाई कहाँ पे आ जाता है ठीक है और कुछ सजेशन
मैम कॉलेज कब स्टार्ट होगा?
दैट आई कैन डू अभी तो चल ही रहा है ना कॉलेज का लेक्चर
गणपति को गणपति को.
Okay. No personal discussions over here. Strictly professional. Please be strictly professional. Whatever lectures, it is actually lectures are going on. So don't think that what your lectures are going on. Right? Okay. So thank you very much.
स्क्रीनशॉट घ्या पटापट. अटेंडन्स